Afternoon, everyone. I'm Lisa Washington Thomas. I want to welcome you to our collective TA for the Families Are Stronger Together Learning Community. We have a wonderful TA activity planned for you today. We have speakers from Chapin Hall, as well as a former state director, as well as a representative from our Assistant Secretary's Office of Planning and Evaluation, Don Winstead. Child Trends will be talking to you as well as, and we have two sites who will be talking about their practical experiences of using TANF dollars to fund child welfare prevention. So thank you for coming, and I am going to turn this over to Commissioner Jones-Gaston, the Commissioner for our Children's Bureau in our sister agency in ACF. Commissioner Gaston.
Hi, good afternoon, everyone. Rebecca Jones-Gaston, Commissioner for the Administration for Children, Youth, and Families, which has the Children's Bureau and the Family Youth Services Bureau, and super excited to be in partnership with our Office of Family Assistance in this conversation. And so just wanted to welcome everybody and maybe prime you with some things to be thinking about as you go into this learning opportunity today, with some things to remember and be thinking about and move into your conversations and your action plans that you're developing. Child welfare and TANF have lots of opportunities to work together, and don't let anybody tell you that's not true. It absolutely is true. And you actually have a lot of authority and ability to drive that yourselves at the local level and decide together how you're going to spend funds on child welfare and in support of families, and where and how that happens. You can educate and advocate and inform the legislative branches, the executive and administrative branches around what can and can't happen, but also the vision that you have for what you're wanting to do collectively and how you're wanting to use your finances together to meet the needs of children and families. That's exactly what this FAST Learning Collaborative platform is for being able to explore together and really generate some potentially new ways of thinking about how do we serve children and families together. So think about your action plans as you're hearing about all of the possibilities that actually already exist. And if, as you're exploring this in your own jurisdiction and in your conversations, there are things that present themselves as barriers, hurdles, questions about whether or not you can or can't do it, lift those questions up. I know my colleague Ann Flagg over in the Office of Family Assistance, myself and Associate Commissioner Schomburg with the Children's Bureau would be happy to engage in some conversation and consideration about whether or not it's that you can't, or that we need to think about how it is that you can, and the important things to consider when wanting to do things together and in a different way. So I'm excited about what you're going to learn today, and I'm going to just sit here quietly, but really just wanted to plant those seeds as you hear from our experts today about what the possibilities are. And my side plug is, the more you understand how the federal funding streams work, the more creative you can be with how you actually apply them in your jurisdictions. So take care and look forward to hearing what you come up with.
Thank you, Commissioner Jones-Gaston, and I will turn this over to our moderator and organizer for today, Claire Anderson from Chapin Hall. Claire.
Thank you so much. And thank you both for that inspiring, innovation-focused, forward-looking opening. We hope to live up to that. We're really excited to provide today a platform for you all to think together about the intersection of TANF's first statutory purpose: provide assistance to needy families so that children can remain at home or with relatives, and the child welfare statutory goals of safety, permanency, and well-being. So we're going to try and provide you with information that helps you think about upstream of child welfare so that families do not come into the child welfare system. And once kids are known to child welfare, how you all collectively think about your dollars, your financing there, as well as upstream. Braiding funds, thinking together about where and how to put your energy and your resources. So today's focus really is about those funding financing streams and what we know about them in this particular context. And we're going to look at data from a bunch of different directions, from the Child Trends Survey of Child Welfare, the data from OFA, and the reports that states send to OFA and how those dollars are being spent, and a survey of child welfare leaders about what the needs are that they see and where and how they think that those needs can be met. We're also very fortunate today to have two of the states present their innovations to you in some breakouts. So we're going to start with the TANF and child welfare funding data and insights from surveys. We'll go to the cross-site team breakouts. Then we'll come back together and debrief. What are the implications for your action plans? What are the decisions that you all want to make together? How might these innovations that you're trying to accomplish in your action plans be achieved? So we are looking forward to a fast-paced discussion. You've been given a number of handouts in the calendar item with links or attachments, and we hope that you refer to those. And we are going to open up. Let's go to the next slide with Don Winstead of Don Winstead Consulting, who has deep expertise in financing across both TANF and child welfare, given his long-term leadership in the field. Don, over to you.
Great. Thank you so much, Claire, and it's great to be with you this afternoon. And I'm going to start with a visual aid that's not the slide, that if you're able to see me on the screen, because I like to tell folks that when TANF was birthed, I was not in the delivery room, but I was sitting outside in the waiting room, I think. And to show, this is my very own copy of the Personal Responsibility and Work Opportunity Reconciliation Act of 1996. And one of the things that anytime we talk about TANF, we start off, as Claire started off with, purpose one, and we talk about the 4 purposes of TANF. And that's true. That is correct. And if you look in the federal regulations, you will see that is absolutely true. However, if you look in the law, in the statute, you will find statutorily there are really not 4 purposes of TANF. There's one purpose. And let me read it to you. The purpose of this part, meaning TANF, is to increase the flexibility of states in operating a program designed to, and then it describes 4 things. So in your discussions today, if you find ways to increase flexibility, to be innovative, you are not only doing a good thing, but you are fulfilling the purpose of TANF when it was originally created. Next slide. Okay, each year, the Office of Family Assistance and Flag's office publishes a collection of the data that you all send in, all the TANF programs send in on your financial reports. If you have not looked at this, it is a treasure trove of information. It goes back for many years, and it gives TANF expenditures. It used to be you would hear a lot of complaints from Congress and from congressional staff that there wasn't enough detail. So they've added detail over time, so that now you get a very, very detailed view of how TANF funds and maintenance of effort funds are spent. Next slide. So in all of that detail, there are several rows of reports that are particularly relevant to child welfare. Now, what I'm going to share with you based on these federal reports is kind of from a perspective of how much of TANF is spent on child welfare. And then when my colleague Christina Rosinski from Child Trends talks, she's looking at the survey that's looking sort of from the direction of how much child welfare expenditures comes from TANF. But in terms of TANF, the categories, there are categories of basic assistance, particularly relative foster care payments, adoption and guardianship subsidies. There are foster care payments that were authorized under prior law. Some of this was under the old AFDC 4A emergency assistance and other provisions of former federal law. There's non-assistance under prior law. And then also child welfare services, and there's 3 subcategories that are listed under child welfare services. 1, family support / family preservation and reunification services, 1 for adoption services, and then additional child welfare services. Next slide. So in the material that was sent out to you, for each state, there is a sheet that shows what these expenditures were. You can see collectively in 2021, which is the latest published information, the total child welfare related expenditures, $2.344 billion in terms of federal funds. And you can see how this breaks down between those categories, with about half of that, about 1.2 billion listed in the child welfare services category, and then that's split mostly between the family support, family reunification category, and additional services. So there is a sheet that you have for each of your states that shows this information. I've also added to that the amount of your TANF block grant, that is your state family assistance grant, so you can see how this compares overall to your TANF expenditures. What you will see when you look at that information, you will see that in several of your states, I'll call out Arizona, Kentucky particularly, then maybe West Virginia and Iowa, substantial portion of TANF funds goes to your child welfare expenditures in the various categories. In some of your states, very little of your TANF expenditures, at least in the most recent year, is listed going to child welfare. So, like with most things in child welfare, things vary. There is the average state does not exist. There is a lot of variation among states, but at least this information on that handout will give you some context in terms of what your child welfare expenditures look like from TANF. Next slide. Another part of the TANF story that I think is very important to potentially include in your thinking is unobligated funds. And as all TANF people know, one of the really unique and amazing things about TANF is that TANF federal funds are available to states without fiscal year limitation. So that means that if you have funds remaining at the end of a year, you can roll those into next year, into next year, into next year. Over time, some states have accrued fairly significant balances of unobligated funds. And the opportunity that potentially creates is if you want to do some things that are creative and innovative and you have unobligated funds, then you have the potential, because since TANF is a block grant and is a fixed amount, if you're spending it all and you want to spend it differently, then that means you have to reduce one area and to increase another. But if you have unobligated funds, at least it gives you some potential there to consider. And you see, as of September 30, 2021, where the amounts are, and with the exception of California, each of the states listed here do have some amount of unobligated funds. Next slide. This slide just tries to put that amount in context, and this shows the amount of the unobligated funds in 2021 as a percentage of your state block grant, as a percentage of your state family assistance grant. So, for example, Arizona, your unobligated funds represent 27% of your block grant. West Virginia has an amount of unobligated funds about equal to your block grant. So that gives you a particular, at least potential there. And you can see where that arrays among the states represented here. And I do want to apologize to the tribes that I don't have this information for the tribes, but if you look at there, we'll see. And I see a note there that they made a huge dent in there, and emphasize this is a year old. So that hopefully is the case, and but at least outline some opportunities. Next slide. So the other thing I wanted to just highlight as a transition to Christina's presentation, TANF is one important funding source, as Claire said. Another important funding source is Family First Prevention dollars. All of the states that are represented here have approved Family First Prevention plans. As do most states. There are only a handful of states that don't have now. However, one of the things we've seen is once your plans are approved, that does not mean that the funding spigot turns on in a gush. So there's a lot of things that you have to do to get the claiming going. And you can see of the states represented here, 2 states, Arkansas and Kentucky, started claiming in fiscal 2020. Then Iowa joined that group in 21. And then in 22, 5 states had claims. And we don't know the claims yet for 23 or 24, but we can track through the HHS grant system does show grant awards. So we can show that most of the states represented here have at least received grant awards for 22 or so far in 24 to start. So the amount of money is developing, but as you think about how to look at the funding sources available to you, these prevention services dollars in conjunction with potentially TANF dollars are 2 of the important elements as you braid together the funds to increase your ability to serve families and prevent unnecessary entries into foster care, and also the broader issues of poverty that affect families that we're working with. So that's the information I wanted to share today, and I will turn it back to Claire, I think, who will introduce Christina.
Absolutely. And immediately over to Christina Rosinski of Child Trends.
Great, thank you. So hi, everyone. I'm Christina Rosinski, and I'm a senior research scientist at Child Trends. For those who aren't familiar, we're a nonprofit, nonpartisan research organization that focuses exclusively on improving the lives of children and families. And so today I'll be sharing with you some information from a national survey that I lead about how child welfare agencies finance their work, with a special focus on TANF. And we refer to the survey as the Child Welfare Financing Survey, and it is supported by the Annie E. Casey Foundation and Casey Family Programs. We send this survey out to child welfare agency administrators every other year, and the latest data are from state fiscal year 2020, which represents the 12th time we've done this survey since 1996. And the goal of the survey is essentially to document the sources and amounts of spending by child welfare agencies across the country. And the data that we collect allows for the documentation of national trends, but also state-specific trends and enables comparisons between states. For this latest survey covering state fiscal year 2020, 46 states, including DC and Puerto Rico, we just call them states for shorthand, but 46 participated in the 2020 survey. Unfortunately, Georgia, Hawaii, Idaho, North Dakota, Washington, and West Virginia were unable to respond this year, so I don't have updated data for those states. And unfortunately, the survey only surveys states, so we don't have information at the tribal level. And so when we send out the survey, we provide instructions that we are looking for expenditures on child welfare activities. So this isn't, the data I'll share is not, appropriated funds, allocated funds that may not have been spent, but rather the data I'll be sharing are, actual expenditures for the programs, the case management, the administration, the operation of state's child welfare services system. Next slide, please. So the survey captures comprehensive information about child welfare agency expenditures in the sources that they use. So just kind of a broad grounding. We ask about state and local funds, of course, and we also ask about a variety of federal funding streams, including Title IV-E, which can be used for foster care, adoption, guardianship, prevention, like Don was just saying, the Family First Act, Effective IV-E, as well as transition supports for older youth. Also, Title IV-B of the Social Security Act, which can be used for a variety of purposes, including prevention, family reunification, adoption promotion, and other activities. Medicaid, which provides health coverage and services. Social Services Block Grant, which is a flexible funding source that states can use to promote self-sufficiency, prevent or remedy child maltreatment, reduce the inappropriate use of institutional care, and more. And then, of course, TANF is part of this kind of financing picture. And you'll see on this slide here, I've grouped the funding streams into dedicated and non-dedicated. So by dedicated, I'm referring to the funding streams that have their main purpose being for child welfare activities. And the non-dedicated ones, Medicaid, SSBG, TANF, they can be used for child welfare, but their purpose is much broader than child welfare. So that we'll come back to that in a moment, but just for some grounding, that's the terminology I'll be using. And then in addition to the state and local and federal funds, we also ask on the survey about other funds, which are things like private dollars, third-party in-kind contributions, and third-party income used as offsets like Social Security and child support. Next slide, please. So this slide kind of puts those funding streams into a little bit more context. This shows the national percentage of child welfare agency expenditures that come from each of the various funding sources. And so nationally, TANF represents about 9% of child welfare agency expenditures. So it's certainly not the largest source, but it's also not a small source either. It is a significant player for child welfare agencies. Next slide. And since the financing survey has been conducted for many years, we're able to look at changes over time. And so you can see here how TANF expenditures by child welfare agencies has changed over the past decade. And among states that had sufficient data in 2010 and in 2020, TANF expenditures have decreased by 14%. And between 2018 and 2020, this represented a 5% decrease in child welfare agency expenditures of TANF. And, the natural question that comes next is, well, why? There are luckily many factors contributing to this decrease. But one in particular is that, since TANF can be used for a wide variety of services and purposes and activities, the use of it for child welfare can fluctuate, and this is particularly likely during economic downturns when there's often an increased pressure on TANF due to higher caseloads involving cash assistance. So that could help explain some of the variation that we see over time. So the data I just shared with you it's all national. And as Don was just saying, child welfare financing is very state specific. So for example, when we look at child welfare agency spending of federal dollars, there are some states where over 40% of child welfare agencies federal spending is coming from TANF. An example is Michigan. On the other hand, there are many states where less than 10% of child welfare agency federal spending is coming from TANF, like California, Montana, and Oregon. And on the next slide, this illustrates that same point, but in a slightly different way. So here I show 4 states that represent 4 child welfare agency funding profiles that we've identified over the years. The first one, represented by South Carolina, is a balanced funding structure. Basically, this is when a child welfare agency uses a mix of federal and state and local funds and draws on a diversified selection of federal funding sources, both those that are dedicated, like 4E or 4B, and those that are non-dedicated, like Medicaid, SSBG, and TANF. Another structure that we've identified is the federal dedicated structure, represented here by New Hampshire. This is when the child welfare agency is using more federal than state and local dollars and draws primarily from the dedicated funding streams. Kind of the reverse of that is the federal non-dedicated funding structure, represented here by Michigan, in which the child welfare agency uses more federal than state and local funds, but relies heavily on the non-dedicated funding streams, including TANF. And then finally, Delaware is an example of a state and local funding structure where the child welfare agency is, relying primarily on state and local funds as opposed to federal dollars. So basically, the moral of this story is that every state pieces together the financing of their child welfare system differently, and that is applying to the use of TANF as well. So in the next slide, I know the next question that's probably coming up in your mind is, okay, we're spending these dollars for child welfare, but how? What specifically are we using TANF for? And so on the survey, we asked states to rank the top 3 service categories on which their child welfare agencies spent TANF in 2020. And so the figure on this slide shows the number of states putting each of these categories in their top 3. And so, I have a series of slides here where for each state, I've kind of flagged where your top 3 kind of fit in. And so, as you can see, for Arizona, the child welfare agency is using TANF for this other child welfare services category, which is services provided to children and families at risk of or involved in the child welfare system. Also spending it on family preservation services, so community-based services to help children remain in or return to their home. And then also relative foster care payments and adoption and guardianship subsidies. This is basic assistance provided for a child that the child welfare agency has custody of, and the child is living with a relative caregiver, as well as basic assistance to children living with a legal guardian and ongoing adoption subsidies. So for Arkansas, on the next slide, they're also using TANF for family preservation services, but their second top category is emergency services, which are services authorized solely under prior law. Don was mentioning this before, when AFDC kind of converted into TANF, states were allowed to continue to provide some services that were previously authorized under AFDC. So this is in Arkansas, this is an example of them doing just that. And then the third top category for Arkansas is, again, this other child welfare services category. In California, the their top use of TANF is for child welfare services, which is defined as services provided to children and families involved in the child welfare system that were solely authorized under prior law. So same thing as with this emergency services category, services authorized solely under prior law. And California's third top use of TANF by their child welfare agency is relative foster care payments and adoption and guardianship subsidies. In Iowa, the top use is family preservation services, followed by another category, which is kind of a catch-all for, everything else that doesn't fall into these other categories. And then the other child welfare services. And I'll pause here and just fully acknowledge that some of these category names and definitions are frustratingly vague. So, sometimes there are, clear distinctions, it's authorized under prior laws, not authorized under prior law, but there is some gray area in the categories as defined in the reporting to OFA. So just acknowledging that if you're feeling like, oh wait, what's the difference between other child welfare services and child welfare services and other, you're not alone. But hopefully the definitions I've put here help a bit. So moving into Kentucky, the top use of TANF by child welfare agencies in Kentucky is relative foster care payments and adoption and guardianship subsidies, followed by benefits for children in informal kin settings. So that's payments for a child where the child welfare agency does not have custody and the child is living with relative caregivers. And then Kentucky's child welfare agency also uses TANF for work, education, and training activities. So think subsidized employment, education and training, and other work-related activities like job search, things like that. In Michigan, their child welfare agency is using TANF for services for children and youth, which is a broad category capturing programs to support and enrich the development and improve life skills and educational attainment of children and youth. And then also the relative foster care payments and adoption and guardianship subsidies, and another example of a state using TANF for benefits for children in informal kin settings. In Montana, they're using TANF for child welfare services, emergency services, and relative foster care payments and adoption and guardianship subsidies. And then finally, in Oregon, the top use of TANF by child welfare agencies in this state are foster care payments, which is foster care assistance for children that was authorized solely under prior law. Emergency assistance, which is assistance or benefits authorized solely under prior law, and then program management, which is just what it sounds like. So on the next slide, I just have a little, little thumbnails to show you that we have a suite of resources available that you can dig into more, including a national report. We have fact sheets for each of the funding sources that I was talking about earlier. We have a fact sheet for each state that responded to the survey and a spreadsheet of data. And so if you ever have any questions about, the information presented in these resources, want to go, into greater depth about your state, feel free to reach out. I love talking to folks about financing and geeking out about your state's data. And I have my email on the next slide if you ever want to reach out. So thank you. I'll pass it back to Claire.
Fantastic. Thank you so much. Such rich information in terms of the different ways to look at financing and spending in the states. Just going to give you 2 more slides or 3 before we break out into our small groups. Chapin Hall and the American Public Human Services Association recently fielded a national survey of child welfare leaders to understand their perceptions and beliefs about meeting the economic and concrete support needs of families. And I'm just going to show you 2 or 3 findings that relate to the discussion today. You can skip to the next slide. The first question really was, what are the beliefs by child welfare leaders about how often economic and concrete needs are present once families become known to child welfare? And you see that respondents said childcare money and housing needs are frequently present in suspected maltreatment reports, followed by transportation, food, and employment. I don't think that there's anything that is rocket science about this, but this might be among the first times that we've been able to quantify from the child welfare perspective the extent to which these are present, meaning this is a problem to solve in addition to the core set of challenges that child welfare is always focused on in terms of safety. Next slide. We asked what approaches are state child welfare agencies using to offer economic and concrete supports to families. And you'll see on the right-hand side, I'm just going to talk about this. How does your agency pay for economic and concrete supports? You'll see state funds, 4B funds, 4E funds, and then transferred TANF funds. So these dollars are being put to active use in some states in terms of actually providing a direct concrete support or an economic support to family. Next slide. And I think this is the last slide that I have. We asked, okay, so where and how, I believe, what system should help families access economic and concrete supports to prevent child welfare system involvement? And we met that both in terms of upstream prevention and prevention once families are known to child welfare. And you see that child welfare leaders believe that the public benefit system is better positioned to support families in meeting their economic and concrete support needs. Those leaders are more likely to prefer that the public benefit system is part of the solution. Child welfare leaders also agreed strong. 21 of the states and 15 of the states, I think there were 35 or 36 states that answered this question, said that child welfare strongly agree should be providing economic and concrete support. So there's a clear willingness and interest in partnering together to make a different set of decisions about how to provide economic and concrete supports to families. I will drop the link to the survey in the chat so that you all have it. And I will also drop into the chat one other set of state profiles. You've got the OFA profiles, you now have the Child Trends profiles, and the Center on Budget and Policy Priorities also does a set of state profiles as well, and those are there. All right, so I think that sets us up nicely to go to the breakouts. And we are very fortunate to have 2 states talk about their collaborative decision-making and action planning around funds to support families, both in upstream prevention, and we'll hear from Kent in West Virginia. Thank you very much. And Michelle, I believe. Thank you. So that's really that focus on upstream. How do we braid upstream? And Kentucky will talk about using flexible funds for concrete supports in its family preservation program, which is after children and families come to the attention of child welfare and an open family preservation case is decided. And flexible funds for concrete supports have been available there for many years using a combination, likewise, of child welfare and TANF funds.
All right, awesome. Thank you. Hey guys, I am Dana Fryman. I am the branch manager within the Division of Prevention and Community Wellbeing out of the state of Kentucky. Our Division of Prevention is fairly new. We're doing lots of exciting work with upstream services. It's a different day and age, is what I say in our agency now, since we get to actually put so much energy and effort and dollars into prevention, which is exciting. So today I just have a quick presentation here. Let me see if I can share my screen with you guys. Okay, can you guys see the PowerPoint? Okay.
Yes.
Okay. Is it still there?
Yes.
Okay,
It's showing
sorry.
us presenter view so we can see your notes if that's what you want us to see.
Okay. Let me see here if I can swap that really quick. Sorry, I have too many screens up right now, guys.
I know
But
the
It looks
feeling.
fine. I think it's okay.
Yeah.
You know,
Okay.
we can see it just terrifically.
Okay. I didn't know if it was big enough for everybody. Okay. So we're going to talk about Family Preservation Program and Kentucky's prevention and how our journey began. And like Claire mentioned earlier, Kentucky has utilized our funds, our Title IV funds. We use Title IV-B funds. Sorry, I'm so used to saying Title IV-E. And also TANF dollars for our flexible funds within the Family Preservation Program. FPP services in Kentucky have included this funding for more than 25 years. It's been statutorily mandated since 1990. It's an era of short-term crisis interventions and support services provided in the family's home. And then again, to qualify for FPP services, families must be at risk of entry into care or have a child in care returning home. So that family preservation piece or the family reunification services. And then again, FPP is funded with Title IV-B, promoting safe and stable families, TANF, and state general funds. And then also now including Family First as well. So when this started, I will say that the home builders model really looked at that hierarchy of needs and really talked about it, included that piece about we have to meet families' basic needs or we're never going to get any further with them, right? I mean, doesn't that make such great common sense? But sometimes it feels like we're beating our head against a wall. Like we have to make sure families are eating and keeping the lights on and have a roof over their heads, right? If we want to talk about safe and effective parenting, because we know that you can sit and talk about that all day long. But if a family is in crisis mode and they're thinking about how are they going to feed their family throughout the week before their paycheck comes, or how they're going to pay, you know, an extremely high electric bill because it's been super cold or a month, you know, I'm just thinking of examples in Kentucky, they're not going to be able to absorb the information that we're trying to present, or even, you know, the interventions that we're trying to provide them with. It's not going to do any good if we don't meet those concrete needs, right? I think we can all relate with that. So there was a formal evaluation of Family Preservation Program in Kentucky. This was in 2006 and 2007. Obviously, we had better outcomes for our group of folks that were involved with Family Preservation Program than the comparison group. Every dollar spent on Family Preservation Program services saved $2.85 in out-of-home care cost. And I think this is important because when you're talking about the political environment and speaking to representatives, this is what they want to hear, right? How can we save money in the long run? And this is how you really get that buy-in. So 94% effective in avoiding entry into out-of-home care. And then recommendations included expansion of services to address unmet need and expansion of flexible funding. And then Dr. Ruth Huebner published the evaluation and presented at the Child Welfare League of America conference in 2008. So again, what we know with this is that, especially when you're talking about this and you're having conversations, if you really focus on that piece of spending the money upfront in prevention will save in such a long term. And we're going to show some graphs here in a minute that will kind of actually lay that out of the money that is being saved when you're spending dollars on out-of-home care. And we all know that out-of-home care costs are not cheap, right? And it's not what's best for our families in a lot of these type of cases, and we can keep families together. So what is flexible funding and what does that look like? So it's available money to be spent at the caseworker's discretion to enhance the success of the intervention. And then concrete support rather than an economic support, because it is not cash assistance directed to the family. Historically, it's budgeted at $500 per family. And I will say, when I was years ago back in the field, it was $500 and we thought that was great. Now it's $1,500 a family, which is awesome, I think. Yes, I know the price of everything has went up, but I just think that that is astronomical. I know that a lot of times what we're seeing is, things such as utility bills, helping pay rent, helping with a car repair so that someone can get to and from work. Just those simple, those needs that families have that they're just not budgeted for. So just being able to help and provide those supports, really, we've seen a great increase basically in reducing our numbers of out-of-home care. Leveraging progress for greater investment. So the demonstrated impacts of prevention services led to an additional $20 million appropriation of state general funds for this fiscal year. The increased FPP contracts by 25% and increased flex funds to $1,000 per family. And again, that has been increased to $1,500 now. I just confirmed that last week. So yeah, so we're going to be seeing $1,500 per family. We've added client assistant funds to our community collaborations for children program for families that are not involved with the child welfare agency. So that's more of that upstream piece as well that we're seeing. And I will also add really quickly, we have a program that we are piloting in Kentucky called Community Response. It is for referrals that do not meet criteria to receive an investigative assessment or an alternative response, but the family still has what's identified as a poverty adjacent type need, and they are referred in our 10 piloted counties to providers that we have contracts with. And what has happened now is that we have some other funding, flexible and economic concrete supports that we can utilize. Now, granted, we went through that funding really, really quick. I think it was 2 months, because we were able to use it in community response. And then our state workers were also able to use it in the child welfare realm. But that money was also available to us in our division to provide to those community response referrals. But we're hoping, fingers crossed, that we're going to get double the amount. I think it's going to be $3 million is what I'm hearing in the talks that we're asking for in the state of Kentucky, to also help address and meet those needs. So over 2,500 families received family preservation and reunification services in state fiscal year 2023. The annual budget for the program has increased from $16.5 million in state fiscal year 2019 to $28 million in state fiscal year 2024. It's currently funded through state general funds, TANF funds, and the federal Title 4E Family First. And then, of course, that's related to the evidence-based prevention services provided through family reunification and prevention services, as well as the flexible funds that are included as a component in these service models. The federal Title 4B promoting safe and stable families as well. And then also we have $1,000. Again, it's increased to $1,500 in flexible funds available per family to meet the concrete needs of families participating in the family preservation program to prevent entry into foster care. And then there is an additional $4,000 in the flexible funds available per family through community action agencies to meet the concrete needs of families with active CPS cases, including investigations, alternative response, and ongoing cases. And also, like I was saying earlier, that is also money that was available to the community response referrals that we were receiving. And those are referrals that were screened out, but also had an identified need, but met the acceptance criteria for a community response. And also as well, those families diverted, again, through our community response pilot. Again, we went through that money really, really fast. We now have a different type of gatekeeper system so that we can really be thoughtful in a process. You know, when you give frontline field services and you tell them they can have $4,000 per family, right, they're going to go wild and they're going to utilize it. I know if I was in the field and you told me I had $4,000 for my families, I would jump up and down and celebrate. So our workers really did. They utilized it very quickly. And again, we're asking for increased funding for that. The Families First Prevention Services Act plus FPP obviously we've created this opportunity to leverage additional funding to expand services to match needs for the first time ever. Our home builders and motivational interviewing were already part of family preservation services. And then we've added other evidence-based practices and increased total investment in prevention services each year. Flexible funding is a component of all of our Families First Prevention and Services Act services in Kentucky. Okay, guys, this is what I was going to talk to you about. So you can see, and I'm sorry, the numbers are a little hard to see here. The data starts kind of in 2016, and then you see that peak there, the children in the custody of the cabinet. So children in out-of-home care really peaked there in 2020 with 10,047 youth. And then we see this consistent decline. Let me see. Yeah, 8,944. Let me get to this because I think this one speaks volumes. So here you'll see this chart. It shows that in 2019, we put in $15,000 roundabout there in prevention funds. And then look in 2021 in prevention funds, we put in 24,000. But look at the difference in the spending for out-of-home care, those red squares there. That's a huge shift from spending 296 to 238. That's a huge difference. So again, it's just really messaging to, everyone, our stakeholders, our legislators, that really spending the money up front in prevention saves so much in the end, and it's better for our families, right? We all know that. All right, next step. So Kentucky, we consider this a journey. We'll continue to push upstream, and I think that even speaks volumes for our new division, our Division of Prevention and Community Wellbeing, that was developed officially. We got a director in January of 2023. So she's been on board now for a year. And we have 3 different branches of prevention: our primary, our secondary, and our tertiary prevention. And we are working diligently to fill those slots with specialists so that we can oversee programs, really be active in engaging, stakeholders, community providers, and figuring out where we can link families, create more creative community service connectors, making sure that we're addressing access issues to families, and really keeping families off of the doorstep of child welfare if at all possible. Budget requests for the next biennium include higher flex funds, and again, that is increased to $1,500, and then leveraging collaboration with community partners and those with lived experience to inform efforts and impact policy. And I will say there is being a lot of work done where we are using individuals with lived experience. I call them lived experts. That's just my term that I have coined for them. We also invite them to the table in a lot of our policy and program work that we're doing, just to make sure that we are being really thoughtful and intentional on how we roll out programs. All right. Any questions, guys? I feel like I went through that really quick, but I wanted to make sure we had time for you guys to ask questions, and I will do my best that I can to answer.
Thank you, Dana, for that information. It's very exciting. And one of the things that we talk about at FastLC is being able to learn from your peers. And Dana has shared just a wealth of information. So let's open it up to the floor. What questions do you have for Dana? And I can't see any hands raised, so don't be shy.
This is Matt from Iowa. How much TANF funding do you guys use approximately?
Sorry, I'm clicking through that and I'm clicking on the wrong screen. I don't know that I have an exact number to give you, and I apologize for that. I do know that TANF funds, we actually do not use as much TANF funds anymore, just because we're using more Title IV funds through our Families First. But I don't know that I can give you an exact. I can follow up on that.
Thanks, Dana. And Melissa, do you have your hand up?
Yes, I do. I noticed when the woman from Child Trends was talking, it was mentioned that a big area of expenditure for Kentucky was benefits for children in informal placement. And I noticed that you mentioned about 10,000 kids in the custody of the cabinet. That's your population in care for foster care, is that correct? And so I'm just curious about that additional informal population, and if that has grown while your in-care population has shrunk, or if that's something that's been steady. And I know I'm putting you on the spot and you weren't prepared for this question and you might not know, but I just found that interesting that that was such a significant proportion of your expenditure, those benefits for informal placement.
So informal placement, and with Kentucky, we don't track relative placements the same as we do out-of-home care placements. We give relatives, we give relatives the option to become a child-specific foster home, which they can do, and they can go through training and they get the same benefits that any other foster homes would get as well. But we do not track what we call relative placement and non-traditional placement, which could be a fictive kin placement.
I got it.
Those are not tracked as out-of-home care. I will say though, I have not heard any, buzzing news that has dramatically increased. And I would think that would have been mentioned if that's been a number that's dramatically jumped up, and that's not been mentioned. I don't have the exact numbers in front of me because that's not something in my wheelhouse, but I've not heard any buzzwords about that dramatically increasing.
Okay, thank you. And I just love the $4,000 per family. I'm telling you, where I have worked, having to cobble together support for buying things for families out of like $20 petty cash requests at a time, that having that $4,000 sounds like a dream come true. Even with gatekeeping, I just think that is such an amazing way.
Yes, and I think we learned some lessons, obviously, that we needed to be a little bit more firm in our gatekeeping. Just, again, you give social frontline staff this kind of money and this support for their families, they're going to use it. I mean, we clearly seen that. I think it was 2 months they went through the money really quick.
Totally.
So, because at first we were kind of worried that staff were not aware, they weren't going to do the referrals. Oh no, we were slammed. So we've been a little bit more thoughtful about how those funds.
All right, sorry about that. That was kind of abrupt, but Kent has joined us, and welcome Kent and Michelle from West Virginia. You're going to talk about the expansion of the Family Resource Centers.
Yes, and I'm going to have to go much faster than I did last time, I guess. I got a little long-winded. First of all, let me just say real quick, I'm working, don't have my usual workflow on a tiny screen. I'm going to try to share, and hopefully that goes without problem. Can everybody see this okay?
We can see it.
Okay. It's still back on where I was yakking at the other group. Okay, let's jump right into it. So West Virginia is a state with problems. We are plagued with generational poverty. This is the state where food stamps started in the 1960s in McDowell County, West Virginia was the pilot. Generational poverty plagues us. We have an opioid crisis that has resulted in us leading the nation in opioid-related overdose deaths. These problems combined have contributed to a child welfare crisis that has led to us leading the nation in child removals. Not statistics that we are proud of, but those are the facts.
Hey, Kent, you're not in presentation view. If you're capable of doing presentation view, it might be a little easier for everyone to see the slides. They look a little.
I don't know that I can. I tried that, but with this working on this tiny notebook, I wish I were in the office, but I ain't.
No problem.
Sorry. So in order to address these issues, we needed to get upstream, try to prevent them before they occur to the best that we are able, try to address them with families in their communities to the best of our ability. We have decided to do that through the use of what nationally are typically called family resource centers. We call them family support centers here because we think it gives a more holistic view of what they do. They don't just provide resources, but they provide all sorts of supports. They help to address poverty issues through the provision of economic and concrete supports. In their statements of work, they are required to have a hygiene pantry, a baby pantry, a food pantry, those sorts of things. But they also are required to have play groups for children, parental support groups, those sorts of things, as well as a whole menu of optional services that we encourage them to provide. So through this, these are physical spaces in communities that are customized to their communities, operated by nonprofit entities serving their communities. And hopefully they can help to address some of these issues, combat poverty through the concrete supports that they provide, really try to help families work through the root causes of their struggles. Early intervention to help families maintain stability, help families deal with substance abuse issues, build community by bringing families in the community together, help them understand that they're not alone in their struggles, that they are part of a bigger picture that plagues our society, and, you know, encourage each other. All of this is designed to be cost effective by targeting early intervention that prevents the need for more costly intervention once families are entangled in the child welfare system. So we've had family resource centers in West Virginia since about 1989. There was a small number of them. We called them Starting Points Family Resource Centers. In the 90s, they were kind of more formalized. The department started to work with them, recognized the need for them. In the early 2000s, there was some state legislation that offered a small amount of funding, or codified the funding uses that the department was already undertaking, and really was a state level recognition of the importance of these types of centers. Our department has been the primary funder of these centers since the very beginning. For decades, we used pretty much solely CBCAP funding for that purpose. It was a tiny amount. They each got about $40,000, and then we're going out to look at foundation funding and other sources of funding to for the services that they provide. About 2 or 3 years ago, we reorganized the Bureau for Children and Families and split out into the Bureau for Family Assistance, which is the TANF agency, and the Bureau for Social Services, which is child welfare. And as part of that, in the Bureau for Family Assistance, Commissioner Janie Cole came on board. She came from an early childhood setting and had worked in these centers a long time ago, and recognized their importance, started carrying that message forward, having conversations with policymakers and decision makers about potential uses of funding. And so at that point, we decided to make a dent in our TANF carryover balance and effectively use our TANF allocation to increase the amount of funding that we could give to these centers to move upstream of the child welfare crisis. And so we set a goal of having at least one center in each of West Virginia's 55 counties. We're not quite there, but almost. We're also doing some internal reorganization. We've created a new division. We'll be hiring some new staff solely dedicated to working with these centers, providing TA and grant management oversight. So in 2022, that's when we made the decision to blend in the TANF funding, as well as working with the Bureau for Social Services, some other funding streams as well. So we lumped in TANF in addition to the CBCAP funding they were already getting, as well as some Title IV-B funding and a small state special revenue account. That's one of those things where you check a box on your tax return. That's the West Virginia Children's Trust Fund, earmarked for child abuse prevention efforts. And so we took the total amount of funding on offer for each center from about 40 grand to 250 grand annually. And through a competitive bidding process, we went from 24 centers covering 22 counties to 40 centers covering 37 counties in 2022. And in this past grant cycle, we got up to 56 centers covering 53 of our 55 counties for a total outlay of $14 million in funding. And so we're hopeful to bring those last 2 counties on board this coming year. And we will have reached our goal of having at least 1 in every county. So from here, we still have some work to do with these entities. We are encouraging them to diversify their funding. One of the goals that we have laid out in our FAST-LC project charter is to have more of these centers that are delivering 4E reimbursable services through their locations and better able to draw down that 4E funding. We've established goals and work groups to help us get there as part of our FAST-LC efforts. But it's really going to take some continued work to get there, but we're confident that we can do this and help to make a dent. And so I am not a finance guy. I'm not real good at math. Michelle may be better at that than I, but happy to try to answer any questions that you might have.
Right. The floor is for your peers. What questions do you have for Kent and Michelle?
I feel like I breezed through that because I ran out of time last time.
And to get us started, Kent and Michelle, while others might be thinking of their questions, when you think of all the work that you've done to do this, were there any partners that were really critical in moving this work forward?
I think the collaboration between our 2 bureaus, the Bureau for Social Services and the Bureau for Family Assistance, was crucial in blending that funding, bringing the 4B and the Children's Trust Fund money in. I think that's going to continue and probably be more important than ever as we work to get more Title IV-E reimbursable services available in these centers. So the FAST-LC has really been a great opportunity for us to kind of, really take that on and tackle that work.
Thank you.
I will say too, there's a lot of public interest in these centers. We were approached just this morning, and I hope I'm not, talking out of church, but by a private entity that potentially wants to give $100,000 one-time funding to each of these centers. So we're going to continue that discussion, see how that goes, but that would be a huge boon to them in standing up their work. So this is getting some traction, and we're really excited about it. Also, to our federal partners at ACF, in working through how we were able to utilize the TANF funding for this purpose, were crucial and excellent partners. Sanjay and Eileen, I don't know if they're on here. I don't have the list up, but they really helped us identify, what elements we needed to include in our state plan, our TANF state plan, around the use of this funding. We had to do some work around getting an intake form and helping the centers understand the eligibility requirements for families that were being served using the TANF funding. We went a little beyond that paper form that we initially developed and actually hired a contractor to do an intakes and reporting system for us to collect that data and make sure that we were appropriately using the TANF funding to serve TANF eligible families. We did expand the definition of need for this purpose. Again, ACF was great in working through that with us.
Others, questions for Kent and Michelle? Because if not, I have another one. So Ken and Michelle, how have you told your story? When I think of everything that you've shared and how you've expanded, you only have 2 other counties left in the state where you want to expand this. Because it's kind of a complex story. How do you tell your story about the work that you're trying to do?
It's tough. There is still a perception largely, particularly among a lot of policymakers at the state level, thinking of the legislature in particular, that families struggling with poverty related issues or substance abuse related issues have some kind of moral failing. It's so much deeper, and it's hard to get that across. Part of what another goal that we outlined in our Fast LC charter is a stakeholder education campaign around these issues. So we're going to be working to better tell that story as we go forward. But right now we're just trying to, have those one-on-one conversations with key decision makers to really help them understand the purposes of these centers and the way we're using our funding for them. Michelle, do you have anything to add?
I think you really hit it there. We're really starting this, but I do think that there were pieces in place that will help us moving forward and have helped land some of the messaging. The child welfare crisis, there is a lot of interest in it and a lot of money thrown at it, and not much result from the outsider looking in. And so, showing that how much we can save and prevent, that background helps with that story, as well as all the work that was done at the federal level already with the implementation of Family First. So that, publicly pushing that out, I think started that process unbeknownst to us at the time. So I think all of those pieces are just building blocks that we get to start from.
Yeah, the story's still being written.
Yes. And what I heard, one of the hurdles is that the perception of who these families are, whether they are deserving or not. Were there any other hurdles that you encountered? And Paige, I see your hand up. So I'm going to defer to Paige first, and then I can ask my question later.
My question is around who are the providers operating the centers? What other services are they providing, and how does that fit into your state's service delivery alignment plan when you're deciding who gets what funds?
So it's kind of a wide array of provider types. Some of these are community action agencies. Some of these are socially necessary service providers. A lot of them have the family resource networks, which are state-funded entities that are designed to kind of analyze the landscape of their county, the available services, the gaps in services. A lot of those are the fiscal agents for these entities. They really offer a wide variety of services. Some of them are drawing in McV funding, doing in-home family education. Typically, the Title IV reimbursable service that some of them are currently offering, and we're hoping more of them will, is Parents as Teachers, which is pretty well established here in the state. One of the centers is actually it's the Mercer County Child Advocacy Center, that has a deep relationship already with the Bureau for Social Services, and does a lot of child advocacy work. And so, it's kind of different, and we take each application on its merits, as long as they agree to the statement of work and are providing the services that we outline in there, the core services. And then, like I say, we give them a whole menu of optional services, and I'd be happy to provide a sample statement of work if anyone would like to look at that.
Thank you, Kent. Does anyone else have a question? Because if not, I'm going to continue my question, if that's all right. So one of the things we talked about is the perception of the families that you serve, and that has been a hurdle for some folks. Did you encounter any other challenges or hurdles in trying to do this work?
I think probably if anything, one of the biggest challenges was internal, in that for one reason or another, we basically that huge TANF carryover balance that Dawn mentioned we had, we really hadn't been able to touch it. It had been difficult to get departmental level and executive branch leadership to agree to a usage of that funding. Fortunately, through some leadership changes and the reorganizations that have been going on, both within the Bureau for Children and Families, within our department, we were able to finally make our own decisions about what we wanted to do with our TANF funding, and got leadership buy-in based on the messaging that we carried to them, and we're able to do that. Did I tell you guys about our biggest use of the TANF carryover funding? Was that this group or the other? So our biggest use of the TANF carryover funding has not been this. It's actually our direct spend on childcare subsidy. So during the pandemic with ARPA funding, we were able to switch to a pay by enrollment model. So we've taken 24 million of that 110 chunk we carried for years and years, and have been able to extend that for another year while we work with the legislature and our congressional delegation to hopefully get a more sustainable funding source. But that's really where we made a big chunk in that carryover.
Yeah, childcare has been a big issue for a lot of programs. So there was a question.
I will say too, real quick, if I could, a lot of these providers offer on-site childcare. So they are also childcare providers getting childcare subsidy reimbursement. A lot of them run, if they're not full childcare centers, they're running after school programs on site. So that's another great service that they provide and a source of funding for them. Sorry.
Thank you.
I think we have everyone back. Give everybody just a half a second. I think we wanted to spend between now and the bottom of the hour just debriefing, open discussion, probably centered on a couple of things. Any big insights that you had, and any particular shift in perspective or big ideas about how this informs your decision making about what you want to do as part of this learning community and the action plan that you want to create for back home. So I'm just going to open it up. Any big ahas? Or even moderate ahas?
Well, while others are maybe thinking, I'll share that listening to both Kentucky and West Virginia, this idea if that we could come together and partner and focus on how we best serve our mutual families, not with the idea of we're just going to do this program or that program, but we believe by providing this service or that service, we can actually make a difference. And pulling together these collective minds and efforts, and thinking about what really do the families need, and including families in that process.
I'd just like to say again, I know I said this in one group, I don't know that I got to it in the other, but how great our partners at ACF OFA have been in helping us work through these issues. So if you're thinking about ways to move upstream, have those conversations with them, and bounce your ideas off of them. They've been very open with us as we work through this, and really helped us identify what we needed to do to be able to use the funding in this way. So that they've been crucial partners.
Nice. And certainly we heard Commissioner Jones-Gaston and today, and we heard Director Flagg in our opening in-person meeting, both of them. If you perceive barriers or you need a thought partner, like come immediately to us. We are here to be in thought partnership with you.
This is Cheryl Treadwell from California.
Cheryl.
I think one big aha for me is I think it's important to look at how you're organized in your structure. I mean, it's easy to collaborate, but what from hearing from Kentucky, I really admire the fact that they restructured their organization to work better together by creating that new division. I know that's been some thoughts that we've had, because I think it makes it easier. Sort of you put the right people together in your organizational structure, that helps a lot. So I think there's some value in having some consideration for that. Of course, that's a big kind of thing to do in a state like California, but miracles do happen.
Especially under your leadership.
Right. So, but I do think that there was some value in just sort of seeing how that made it easier to sort of implement some of the strategies that they identified.
Nice. Enormous implications for your action plan, right? Others?
Can I just say kudos to us all for using that upstream language, for realizing and understanding that we have to go figure out why these people are falling in versus trying to save them once they're drowning. I really loved hearing it from both Kentucky and West Virginia, and I know that we're all doing it. The change of the language can definitely give a change of the mind. And so I just appreciate hearing it across the board.
Nice. Lovely.
This is Amanda in Oregon. One of the big ahas for me is that this helped me realize some learning opportunities I have to find out more about how funding is working right now with our state. So I've been having sort of side chats with some folks, and I think that I have a lot to learn. Right. And so we need to, I need to better understand how we're using our funds right now and reporting them, and where we can make improvements. And so the slides at the beginning in that first 20 minutes really kind of gave some insight to me that I didn't have previously. I appreciated that. Maybe people at a higher leadership level or who deal with funding more often in our organization have a better understanding of that. But for me, this was a good learning opportunity and gave me some action to take forward.
Thank you so much for sharing that. At the beginning and the end of the day, how you all decide to spend your dollars makes a difference for kids and families. And the only way to understand that is that you can spend $1 one way one year. You might make a different choice the next year. And we've seen both Kentucky and West Virginia shift in decision-making over time about how those dollars are spent. And so we are delighted that one person walked away understanding that there are ways to think about how systems are funded, the ways in which those dollars flow from one system to another, and the decision-making that occurs at every step along the way, and what your agency is to influence or to ensure that, and I wrote it down here, that families get their basic needs met, that it's hard to create safety and well-being for them otherwise. So I think we're going, unless there are any closing comments, Commissioner, Director, anyone here from the administration wants to offer any closing comments, and it's certainly fine if you do not. Oh, I see someone coming off of Rebecca, I see you coming off of mute. So if you'd like to offer any closing, I would welcome you to do so.
Yeah, I'll be very brief. This was exciting to hear the examples, and look forward to hearing from all of you as you kind of get back with your partners and are thinking about your action plans. And again, just to reiterate, I know Claire did it, but to reiterate, if there are perceived barriers or challenges that you're facing that you kind of want a sounding board to work through, please, please, please do not hesitate to lift those up so that we can be in conversation with you. And then just a special thank you to the folks that always do a good job of translating some complex financial stuff into regular people speak, so that we can be thinking about opportunities just to continue to serve the children and families that we are serving in our respective communities. So thank you for that.
Hey,
all right, take care.
Claire, I just want to comment. We just sent out an evaluation for today's collective TA event in the chat to all the participants, and we would love if you would take just a few minutes. It's an easy fill in the blank kind of evaluation, and send it back. Thank you.